Hi, this is Andrea from Young Survival Coalition from the floor of San Antonio Breast Cancer Symposium, and we are talking to Dr. Nangia from Baylor College of Medicine, and she's going to talk to us a little bit more about cold caps and the new study that's come out and the technology involved and what the clinical results are.
Yeah, so we get a lot of questions about cold caps and what the data is out there. So here in San Antonio, we presented the first randomized prospective study of scalp cooling in the world. And we had planned to have 235 participants using all types of chemotherapy. And we had one interim analysis planned and planned to stop early if that interim analysis was positive, and it was, and that's where we are today. So in our study, we had 95 women that received scalp cooling and 47 that did not, and were on the control group. And what we showed was that in the women who had scalp cooling, 50% of them retained their hair, and in the control group, 0% did. Now, there's variations. The fit of the cap is key. So the way these machines work is you have this inner cap and this outer cap, and they're 5 different sizes, so each patient is sized. And if it doesn't fit right and there's not pressure throughout the scalp, you'll have kind of patches where you lose your hair. And it's a mini refrigeration unit that circulates a coolant to keep it cold. So before this, what was commonly used in the U.S. were the penguin cold caps. And those are very labor intensive. You have to use them every 30 minutes, and they have variations in temperature because they're like ice packs. You put it on and it's cold and it thaws out, and you have to refit that every 30 minutes. So the idea is that these devices are a little bit more comfortable because you can just fit them once and wear them throughout treatment, and they don't have that variation in temperature. So the other thing to keep in mind is, although half the women kept their hair, there's some chemotherapy regimens where these devices work better and some where they don't work as well, so the hair rate retention can be variable. So not everyone is going to have successful hair retention, but at least it gives someone a chance at keeping their hair if that's something they want to do. The other thing I get asked a lot about patients is, are they safe? And from the data we have, before we did this study, that was one of our questions. And from many, many thousands of patients, it looks like it doesn't increase the risk of recurrence or overall survival. And we will be collecting that data from our study as well.
Thank you so much.
You're welcome.